Menopause and Heart Disease What Every Woman Needs to Know by Robert Autry, MD, MSc. Welcome back to Hearty Health MD. Today, we are tackling a transition that every woman will experience, yet few realize its profound impact on cardiovascular health. Menopause. Understanding the link between your hormones and your heart is essential for long-term wellness. The power of estrogen. To understand menopause, we must first understand estrogen. Primarily produced in the ovaries, estrogen is much more than a reproductive hormone. It acts as a vital chemical messenger that protects the woman's heart. Estrogen helps keep your blood vessels relaxed and open, promoting healthy blood flow. It also plays a crucial role in managing cholesterol. When estrogen levels are optimal, it helps prevent the buildup of fatty plaque in the arteries. However, as estrogen levels fall, cholesterol can begin to accumulate, narrowing the arteries and increasing the risk of heart attack and stroke. Defining the transition, perimenopause and menopause. The transition doesn't happen overnight. Perimenopause is the window, often lasting several years, leading up to the end of menstruation. During this time, estrogen production begins to fluctuate and decline, and it is common to start experiencing symptoms even while you are still having periods. Menopause itself is officially defined as the point when a woman has gone 12 consecutive months without a menstrual cycle. This occurs because the ovaries significantly reduce estrogen production and stop releasing eggs. While the typical age range is between 45 and 55, it can also be triggered earlier by the surgical removal of the ovaries. Early menopause occurs when a woman's menstrual periods stop before age 45, while premature menopause occurs before age 40. Women who experience menopause at these younger ages may have a higher risk of developing heart disease later in life. This is partly because their bodies are exposed to lower levels of estrogen earlier, and estrogen helps protect the heart and blood vessels. Important note on health equity. Research shows that Black and Hispanic women often experience menopause at younger ages and report more severe symptoms. In Black communities, structural biases and reduced access to care often contribute to an earlier onset, making proactive heart monitoring even more critical. Signs, symptoms, and cardiovascular impact. The drop in estrogen affects nearly every system in the body. Beyond the well-known symptoms like hot flashes, vaginal dryness, and mood changes, menopause can trigger silent changes that directly impact your heart. Weight gain and visceral fat. Many women notice weight shifting toward the abdomen. This visceral fat surrounds major organs like the liver and heart, raising the risk of cardiovascular disease. Cholesterol shifts. After menopause, bad LDL cholesterol and triglycerides often rise, while good HDL cholesterol may drop. Metabolic syndrome. Changes in how the body processes sugar can increase the risk of diabetes and the risk of high blood pressure. Sleep disturbances. Poor sleep is not just an inconvenience. Chronic insomnia is a known risk factor for heart disease. Frequent and persistent vasomotor symptoms, such as hot flashes, night sweats. Frequent, more than 6 episodes in a 2-week period, and persistent vasomotor symptoms lasting for more than 5 years can increase cardiovascular risk. Prevention and treatment strategies. The good news is that you can take control of your heart health through proactive lifestyle interventions. Nutrition and activity. Focus on a diet rich in fruits, vegetables, and whole grains while staying active through walking, swimming, or biking. Vitals monitoring. Keep a close eye on your blood pressure and blood sugar levels. Hormone replacement therapy, or HRT. For some, HRT, available as pills, creams, or patches, can manage symptoms. While long-term use has been linked to risk of blood clots or breast cancer, starting treatment near the onset of menopause may provide benefits for certain women. Always discuss the specific risks and benefits of HRT with your doctor to create a plan tailored to your history. Thank you for watching. To learn more and live healthier, find us at HeartyHealthMD on YouTube. If you found this helpful, please like, share, and subscribe to support your heart health.